Right now at 5:30, an exclusive story of survival and a heartwarming return to the place credited with saving a young man's life.
Across the nation, doctors are seeing younger adults suffering from strokes. Jose Alonso introduces us to a young man who's opening up about how this medical episode changed his life.
Hey there, good afternoon. How you doing today?
Not long ago, someone else asked 28-year-old Adam Maddox the same question. Adam stays busy taking care of patients while recalling his story of suffering a stroke and how he got there.
In your 20s, you don't think about, you feel like you're invincible. You go out, you think, oh, I can eat whatever I want, drink whatever I want, and I'll be okay. It's not always the fact. That's not always the fact. Don't get me wrong, like, yes, I have a blood clotting disorder, but it was the high blood pressure, not taking care of myself. So many risk factors.
Just 2 years after receiving care at Norton Brownsboro Hospital, Adam is now an employee as a patient care associate, and he's going back to school and plans to graduate with a nursing degree.
And again, like I said, I never wanted to be in healthcare until all this happened. And
his journey even inspiring his daughter, who watched her dad's recovery.
It's funny because my daughter actually wants to be a doctor. That's what she tells me at the age of 5. That's what she tells me, because she tells me that she wants to help people like me.
Adam now works at the same hospital as the team who cared for him. Dr. Brian Eckerly says it's nice catching up.
He actually had a pretty unusual cause of stroke where he had a vein that was blocked by a blood clot, which caused not only some bleeding on his brain, but also seizure.
Dr. Eckerly says it's disheartening seeing younger patients who've suffered from a stroke.
We think that with lifestyle modification and with medications and with treatments, we can reduce the risk of stroke by as much as 80%. The things we talk the most about with patients are monitoring blood pressure, monitoring cholesterol, monitoring blood sugar, eating well, moving well, exercising.
Adam has since lost weight and is following the doctor's orders.
Why are you sharing your story today?
Raise awareness of, to be honest, of stroke awareness, taking care of your body. There's a lot of contributing factors for a stroke.
Adam went from a patient to caregiver, making sure others are taken care of while continuing his recovery. In Louisville, Jose Alonso, WHAS 11 on your side.
And there are some stroke symptoms you should be aware of: sudden numbness, confusion, trouble speaking, or loss of balance.
And if those symptoms show up, of course, indicates a medical emergency. You need to call 911 immediate. Excuse me.